Hi and Assalamualaikum. My name is Shahira Shabreena Binti Shaik Ismail. I'm from Group 6. Today, my group members and I will be presenting about a question which is Imalash ate a full bag of potato chips while watching TV one evening. What effect did this have on her urine concentration and volume? Explain. So the organ that involved here is kidney. So what is kidney? The kidney is a pair of bean-shaped organs in the renal system on either side of your spine, below your ribs and behind your belly. Each kidney is about 4 or 5 inches long, roughly the size of a large fish. Next, I will be showing you the importance of kidneys. Firstly, kidneys regulate water. It is important that our body contains the correct amount of water. They regulate the amount of water and salts in our body, filtering out any excess water and helping to maintain our body's chemical balance. Second, kidneys remove waste products. Our kidneys help remove waste products such as urea and creatinine from the body. Urea and other wastes are made when the body breaks down proteins such as meat, while creatinine is a waste product of the muscles. As kidney function decreases, the levels of urea and creatinine in the blood increase. The creatinine level in the blood is a very useful measure of a kidney function. It is measured by a simple blood test. Furthermore, kidneys produce hormones. Normal kidneys also make important chemicals in our body called hormones. These hormones circulate in the bloodstream like messengers. The kidneys secrete a variety of hormones including erythropoietin, vitamin D and renin. Next, kidneys help to balance the body's minerals. Many of the substances in the blood and other body fluids must be kept at the correct level for the body to function properly. The body needs these minerals for good health, but they must be kept at a certain level. When the kidneys are working properly, extra minerals leave our body in the urine. Moreover, the kidneys also help to adjust the levels of other minerals such as calcium and phosphate, which are important for bone strength, growth, and other functions. Lastly, kidneys control blood pressure. By carefully controlling the level of minerals such as sodium and potassium in the bloodstream, the kidneys help to control our blood pressure and prevent it from getting too high.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Arfan Hafiz bin Shahuri. In this video, I'm going to present about the potato chip. First of all, originally potatoes have a lot of nutrients. Potatoes are high in B-complex vitamin like vitamin B5 and B6 as well as potassium. Vitamin B5, known as pantothenic acid, can help maintain healthy skin and hair. It also helps reduce stress, depression, and anxiety. For vitamin B6, called pyridoxine, it helps to boost immune system and improve metabolic rate. It can also help treat dandruff, acne, and dry skin. However, when the process of turning potatoes into potato chips takes place, it begins to show negative effect. Process of washing, blanching, and frying the potatoes will cause the potatoes to lose their nutrients. In addition, potatoes have very high concentration of acrylamine. Acrylamine tends to form naturally in starchy food when it cooked at high temperature. Acrylamine is believed to be one of the factors of cancer. Normally, potato chips are being served salted and flavored, so it makes the potato chips are high in sodium. The sodium contained in potato chips may negatively impact the cardiovascular health. A high intake of sodium can cause increase in blood pressure. High blood pressure happens when the blood moves through the arteries at higher pressure than normal. If the blood pressure gets too high or stays high for a long time, it can cause heart problem. Uncontrolled high blood pressure will cause higher risk for stroke, heart disease, heart attack, and kidney failure. Potato chips are also high in fat and calories. This will raise the risk of weight gain and obesity. This is because 1 ounce of plain potato chips or about 15 or 20 chips contain about 10 grams of fat and 153 calories. Obesity may cause changes in certain hormones that can lead to renal cell carcinoma. This is the level for the average calories and sodium contained in 1 ounce of potato chip.
Assalamualaikum warahmatullahi wabarakatuh. My name is Sofiya Binti Zulfaisal.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nurul Dania Binti Nurhadi.
We both will explain about what are the effects to her urine concentration and volume after eating a full bag of potato chips. There are two types of hormones in kidneys that play a role in maintaining salts and water balance. The first one is aldosterone. Aldosterone is a key steroid hormone critical for maintaining salt and water balance. It regulates the concentration of minerals like sodium and potassium in the fluid outside your cells. Sodium levels drop, your body signals your adrenal glands to release aldosterone into your blood. Therefore, aldosterone signals your kidneys to reabsorb sodium into the blood and act on your sweat glands to reduce sodium loss by sweating. Next is antidiuretic hormone or ADH. ADH, also known as arginine vasopressin, is the other key hormone that helps regulate fluid balance. Its job is to conserve the amount of water your body lost through urine. ADH binds to kidney receptors and promotes the reabsorption of water back into circulation, which decreases urine formation. This plays a major role in conserving water when levels begin to drop. When Ima eating a full bag of salty potato chips, it will increase her blood pressure. This is because of the excess of salt will increase plasma osmolality. Therefore, more salts in the plasma and less salts in the cell will cause the water out of the cells to maintain homeostasis. So, the pressure will increase, and the pressure sensors in the series of reactions suppress aldosterone production. Since aldosterone is important for reabsorption of salt in the kidneys, the urine will have higher concentration of salt and increased urine volume. So, the pressure is back to normal. Now, I will explain about salt and water in detail. Sodium's or salt major function involves regulating blood volume or blood pressure. Sodium attracts and holds water, so the sodium in the blood helps maintain the liquid portion of the blood. When a blood volume is too low, sodium rushes into bloodstream, which in turn causes water to rush into the bloodstream. As a result, blood volume increases. On the other hand, if you consume too much sodium, your body may hold on to extra water, increasing the volume of your blood. So, since your blood vessels cannot expand to accommodate this increased blood volume, your blood pressure will rise. And this high blood pressure is a risk factor for many diseases, including heart problems and stroke.
So, regulating sodium is crucial since it serves as a major component of extracellular fluid. Water follows salt. So, when you lost salt, you lost water and vice versa. Next, I will explain about sodium regulation. Sodium balance is tightly regulated to avoid extreme variations in concentration, which can disrupt normal cell function. Balancing sodium plays a critical role in regulating blood pressure and blood volume. To protect against the harmful effects of too much sodium in the bloodstream, the body utilizes a hormone regulation system. When too much sodium accumulates in the circulatory system, the posterior pituitary gland releases antidiuretic hormone. The hormone travels through the blood until it reaches the kidney. Once it arrives, it triggers the kidney to stop producing urine and reabsorb water back into the kidneys, which help dilute the accumulated sodium. When too little sodium circulates in the bloodstream, the production of antidiuretic hormone ceases. As a result, the kidney increases urine production until sodium concentration returns to a normal level. Urine volume regulation. Urine's function involves not only regulating sodium levels, but also eliminating cellular waste products from the body and controlling the amount and composition of the body extracellular fluid. When too much water, waste and electrolytes accumulates in the body, urine production increases. The increased urination helps bring the level back to a normal range. Likewise, urine production decreases when the body experiences a deficit of fluid or electrolyte levels. As the body conserves urine, fluid and electrolytes can be reabsorbed into the body to bring level back to a normal range. In addition to maintaining blood pressure, sodium is needed for proper function of your nerve, muscle and other body tissue. Problems occur when too much or not enough sodium is in your body. Diuretic medicines, drinking too much water, excessive sweating and heart failure, among other conditions, can disrupt the balance of sodium to water. An imbalance can cause symptoms such as fatigue, headache and muscle spasms.
Hi, my name is Yusri. Let's get right to it. So, what diseases are more likely to suffer from? The first one is chronic kidney disease, the second one is cardiovascular disease, and the third one is hypertension.
This is all our references source.
So, let's move to the first disease, chronic kidney disease. High sodium intake resulted in increased glomerular filtration rate and urine output, which is to be a result of hyperfiltration, and hyperkalemia occurs due to high potassium excretion. This also resulted in increase in the extracellular or intercellular fluid ratio, providing a correlation with sodium retention and causes damage to the kidney. Actually, there are some facts about this. High sodium intakes of greater than 4,600 mg a day are associated with progression of chronic kidney disease, but low sodium intakes less than 2,300 mg a day has no significant effect. This is related to urinary tract infection called UTI. So what can be done by Imar to stop her craving? She can cut down the volume of chips slowly until she reaches zero. Let's move to the second disease, cardiovascular disease. How does this happen? Eating high sodium content food causes the body to hold onto water to dilute the sodium. This increases both the amount of fluid surrounding cells and the volume of blood in the bloodstream, meaning more work for the heart. This causes damaged arteries, leading to the heart shutting off oxygen and nutrients to some regions. Secondary hypertension happens, which affect organs such as heart. The two trials of hypertension prevention, called UHB, were conducted from 1987 to 1995 to test the impact of lifestyle changes on blood pressure, such as consuming less sodium. It is found that participants in the sodium reduction group were 25% less likely to have a heart attack after 10 to 15 years. Let's move to the third disease, hypertension. Actually, hypertension occurs due to the suppression of the renin-angiotensin axis. As we know, where sodium goes, water will also flow. Hypertension mainly occurs due to the increase of the blood volume to be pumped by the heart and the reduction of sodium absorption. Thus, this causes an increase in the SNS, that is, sympathetic nervous system. Study shows that population with high salt consumption had higher average blood pressure and greater increase of blood pressure with age. So, how to overcome this problem? Ima should reduce salt intake to less than 5 grams, and she can eat other types of healthy snacks such as cereals and baked beans. So, in brief, the habit of eating bags of potato chips or eating too much of potato chips can increase urine concentration and volume because water follows salt. So, when you lose salt, you lose water and vice versa. Osteoporosis can occur long term because the more you eat, the more calcium your body gets rid of. In severe cases, it may cause cancer as high salt lead to Warburg effect. In 2019, there's a UK boy goes blind after eating nothing but potato chips for years. So remember to eat healthy and the best.